Interestingly enough, there appears to be a strong connection between testosterone and aggressive behavior in most animal species. This would lead one to believe that this would be true in human males as well. But at some point, the effect of testosterone on aggression appears to have tapered off significantly. Testosterone may have different influences on behavior dependent upon age and physiological development. For example, one piece of research found that 12 and 13-year-olds were more aggressive as a result of elevated testosterone. But there was no such connection among boys that were 15 and 16. This could mean that psychological development progresses between the ages of 12 and 16 such that the influence of testosterone upon behavior subsides in some ways. Every species appears to have its own timetable with regard to the production of testosterone. Among humans, testosterone is produced during gestation and during puberty and beyond. Other species, however, produce testosterone in different patterns. For example, rats don't begin to experience an influx of testosterone until they have already left the womb and experience no adolescent boost in the hormone. As of yet, there is no evidence that products designed to homeopathically increase testosterone work. For example, the now famous deer antler spray has shown no steady benefit in clinical trial. Perhaps someday a testosterone supplement will be found to be both safe and effective. But today, testosterone therapy is the only means to achieve a safe and clinically significant increase in testosterone production. Testosterone therapy is safe and effective for patients with a legitimate need, but the hormone is often prescribed without due diligence by the prescribing physician, or is sold illegally on the black market. For example, as of 2013, 1 in 4 men using testosterone treatments didn't even get their testosterone levels evaluated. For these patients and potential abusers, the risks associated with testosterone therapy increase significantly. Only take testosterone therapy with the guidance of a licensed and board-certified hormone doctor. If your doctor is willing to provide you with testosterone without a prerequisite blood test, he or she is very likely putting your health at risk. If you found this video informative, please press the like button and subscribe to the channel. To learn more about health and wellness regarding testosterone replacement therapy, please click the link below in the description.